It was an outing designed to reassure Americans about the health of their president. Donald Trump briefly left Walter Reed Hospital on Sunday, where he's being treated for COVID-19, to wave to his supporters. But now he's facing criticism for endangering his staff and security team, including from attending physician at the hospital, Dr. James Phillips.
That presidential SUV is not only bulletproof but hermetically sealed against chemical attack. The risk of COVID-19 transmission inside is as high as it gets outside of medical procedures. The irresponsibility is astounding. My thoughts are with the Secret Service forced to play.
White House Press Secretary Kayleigh McEnany is the latest Trump staffer to contract the disease. Presidential aide Hope Hicks, Trump's election campaign manager Bill Stepien, and one of his advisors, former New Jersey Governor Chris Christie, have already tested positive for the virus. But the White House appears reluctant to share more details about the spread of the disease within the president's close circle.
Can't confirm anything specifically about private citizens, but we're giving updates as we have them about numbers within the West Wing and initiating contact tracing.
The mixed messaging has investors on edge, with major U.S. indices fluctuating between positive and negative territory.
Certainly inject additional uncertainty as we head toward this election. Remember that since World War II, whenever the market has fallen from July 31 through October 31 of an election year, in every time but one, it pointed to the replacement of the incumbent. So with the market fluctuating between positive and negative, this then puts an ominous omen toward this indicator.
The handling of the outbreak in the White House is also drawing comparisons with its handling on a national scale. The US has so far reported nearly 7.5 million cases of COVID-19, the world's highest. The national infection rate is currently at a 2-month high, and only 3 states are reporting declines in daily new infections. Those who haven't contracted the virus have not been spared its fallout. Millions of people have lost their jobs, thousands of businesses have shut down, and lawmakers are struggling to agree on a stimulus package to help bail out the airlines and dozens of other industries. Experts say the mixed messaging about the president's health could further spook investors and worsen the toll on the world's largest economy. Mobin Nasir, TRT World.
Well, for more on this, Ted Seifried joins us now from Chicago. He's Chief Market Strategist at Zaner Ag Hedge. Great to have you back with us, Ted. Now, we saw a sell-off on stock markets on Friday after Donald Trump announced that he had coronavirus, but stock markets in Asia, the US and Europe seem to have gained some of that lost ground now. Is that a sign that investors are hopeful that Donald Trump will make a recovery?
Yeah, I mean, that's certainly part of it, Oscar. We have heard this morning that they're trying to get President Trump back to the White House today. We saw a number of tweets from him over the weekend and here again today. So that sort of suggests that his health is maybe not as dire as what we had initially feared on Friday. He took his tour in his SUV over the weekend to just show face. And I think by all accounts, he looked well. So, yes, that is helping the stock market here today. In general, uncertainty is a bad thing, okay? But we have some positive things that are working for us here today. In particular, Trump did send out a tweet over the weekend talking about the want or the desire to get a further stimulus package done and asking for both sides to work together. We know that Nancy Pelosi and Secretary Steven Mnuchin have been talking pretty much daily for the last week or so. They spoke again today on the phone for about an hour. They agreed to talk again tomorrow. So that is being seen as progress towards getting a stimulus package done, which if you look at both sides, you know, the Republicans want about a $1.6 trillion package. The Democrats are at about a $2.2 trillion package. That number keeps coming closer together. The weekly payments for unemployment, $400 is what the Republicans want. $600 is what the Democrats want. Those numbers are all coming in closer together. So it does feel like we're getting closer to having some sort of an agreement there. And the market really likes that. It feels like stimulus right now would be a very good time, not waiting until after the election. The market likes that. We're finding strength in the markets today. And again, you know, it's optimistic that maybe Trump will be returning to the White House today. The big question here, Oscar, is is this just the start of this? Are we going to see sort of a domino effect running through the White House? Is coronavirus going to run back rampant through the White House? Or is, like Haley this morning, is this one of the last ones that we're going to hear, and we're going to be able to move on and continue and see, campaigning and debates and a resumption of trying to stimulate the economy?
Yes.
That's what we're trying to balance out here. But at least for the moment, here this morning or here today, we're feeling like there's a little bit more positivity. Trump might be coming back to office, or when he does get back to the White House, we pretty much all feel like he's going to be very active. And he's really the one person that we really need to have an effective government right now.
Okay. Meanwhile, as you say, the number of people in Trump's inner circle who have contracted the coronavirus seems to be growing. We now have the White House Press Secretary Kayleigh McEnany, who's announced that she has the virus, and apparently 2 of her aides do as well now. How worried are investors about the fact that the Trump administration can't seem to contain the coronavirus within its own circle, let alone the entire nation?
Yeah, so and that's been a big criticism, over the past couple of months. We've seen rallies and meetings and get-togethers that have been without masks and without proper social distancing and things like that. I think this really kind of changes their outlook, or at least you'd hope so. But yeah, I mean, it does give the Democrats or the people that aren't big fans of Trump more ammunition to really criticize. Although I will say this. When you have a 74-year-old man who is, by all accounts, rather overweight, or some would say obese, contracting coronavirus, which, this is the demographic that we're most worried about with the coronavirus.
Yes.
And he is seemingly getting very good care, obviously the best in the world, because of such high importance. But for him to be doing fairly well with it and not being in dire straits, or at least that's not what is perceived to be at the moment, it's sort of also making us feel a little bit like, okay, well, if Trump can get through it fairly easily and fairly quickly, well, then maybe this isn't as dire of a situation overall. So some very mixed feelings about this right now. Again,
Okay.
the criticism will continue because there is a lot of people that really want to criticize Trump, and this is another talking point for that. But also the fact that he's doing well, I think, is a really interesting feature too.
Okay, Ted Seifried, we'll have to leave it there, but thank you again for joining us from Chicago.